So, Dr. Corradino, hello. Um, Neuropuncture is a word you invented, or can you maybe explain it a little bit more to the average acupuncturist?
Yes, absolutely. Thank you. Yes, that word is a word that actually I created. It is a word that we trademarked internationally. It's a patent pending system. It's a copyrighted word. And I'm kind of very happy I did that because that planted a little bit of a flag of the birth of neuropuncture. And I think even of the evolution of acupuncture, because since then there's been so many interesting systems that have been described using somewhat of a neurology network, and they have very similar terms, so not to be confused with other maybe scientific based acupuncture systems. Neuropuncture is specific to our organization. And what is neuropuncture? So neuropuncture is a complete neuroscience acupuncture system that specifically teaches you, the practitioner, how to neuromodulate our patient's nervous system back into health using electroacupuncture. So what does that mean? So if you go back to the classics, the Ling Shu, it always was neuroscience. I really believe that. We have the data to prove that with proper translations of the Ling Shu and looking at the evolution of medicine. So when we understand that, then we can use that lens that every time we're inserting a needle and stimulated with a very specific, gentle electrical dosage, we are communicating with the nervous system. And depending on what language, what we tell the nerves, that is going to be dependent on our settings, and then that will influence the outcome or the response of the nervous system. So when we look at neuromodulation, or what does that term mean? Simply, it means that we're going to be inserting our acupuncture needles, we're going to be connecting them to electrodes, right? And then we're going to be sending little signals into those needles using a safe, very properly and accurately calibrated machine to communicate with the nervous system. And we are sending different frequencies. There are different currents we can use. There are different voltages. There's also pulse width, sweeps, and some other unique parameters we're going to be using. And studying those electrical parameters really gives us the language on how to best communicate with our central nervous system. So if we're treating hypertension, the neuropuncture prescription, which is peripheral nerve stimulation with specific dosages, actually activates the RAS system in the body. And the RAS is the renin, aldosterone, angiotensin system through the hypothalamus. So every time we're inserting acupuncture needles and stimulating it, whether it be with an electrical stimulator or manual stimulation, you're still sending those signals into the nervous system. And depending on how you stimulate those needles, it sends those signals, which are frequencies. So we're always communicating with the nervous system. And that communication is described as neuromodulation. Sometimes we refer to neuroregulation, sometimes neurorehabilitation. And not to get confusing, but all of that means that we are communicating and impacting the nervous system directly with electricity. Now, something else that's really interesting and something that I came across years ago, but it just validated what I just said, was because these devices that we use are FDA approved for electroacupuncture, right? We have to have our devices legally approved so that we can use them safely. Well, guess what category they're actually labeled under in the FDA? Neuromodulation, electrical neuromodulation. So the devices we use are actually categorized under the FDA for the purpose of neuromodulation. And what neuromodulation means, that we're going to be communicating and directly impacting the nervous system directly. And I think that those are game changers in our profession because once you really identify with the pathological nerve or system in the body that needs to be impacted, by stimulating, communicating with electricity, you get instant results. I mean, that's the power of neuropuncture. You should get instant results. Now, obviously, with certain cases, We're not always going to get 100% results the first treatment, right? It takes time for some of these nerves to heal and for the neuroplastic changes to take hold. But we want to see, in some cases, very abrupt changes.
Can you give us an example for a quick change from your experience?
Yes, I have a great example. This is actually a somewhat comical example. So I have been doing a lot of human dissections at a Miami surgical training center. And we have surgeons work with us, and we're always dissecting. Recently, for the past probably 5-6 years now, we've been really examining the face, the facial nerves, and the throat. There's a lot of beautiful structures in the throat that we can access with acupuncture needles very delicately and communicate with them very gently with some electricity and have major impacts on the body. And some of those structures, namely, are the phrenic nerve and the vagus nerve and the stellate ganglion. But the phrenic nerve is what we're going to discuss now. So the phrenic nerve innervates the amiohyoid muscle, right, which is this little muscle from the hyoid bone right up to the jaw, right? So we're going to be needling those little muscles. Why? Because the phrenic nerve innervates that muscle. And the phrenic nerve only has one function, and that is to regulate the diaphragm for breathing. But the diaphragm also gets pathological, not only with difficulty breathing or conditions that can result in difficulty breathing, but also in hiccups, right? Hiccups, right? So when we have hiccups like that, what we wind up doing is that phrenic nerve is getting really, really activated. So, oh, sorry about that. So what we want to do is insert the needles there and stimulate with a little bit of E-stim. And I had a patient who had incessant hiccups for, I think it was 3 days straight. 3 days straight, he could not stop hiccuping. He actually even was vomiting at times. So he was actually a house guest of mine. So I brought him into my study, and I had 2 needles and 1 E-stim. And all I did during the treatment, I had him lay down, and while I'm palpating and assessing his throat, he's hiccuping, hiccuping, hiccuping. He's been doing that for 3 days straight. I inserted 2 needles, connected the leads, and the research says once the E-stim affected those muscles, and those muscles will fasciculate, so you'll know that they've been activated, that phrenic nerve is activated, depolarizes, repolarizes the neuron, and then will reset the diaphragm. And soon as I turned the electricity on, it stimulated the phrenic nerve, and the hiccups immediately stopped. Immediately stopped. I have this actually on video, and I'll be showing it to Israel when I come there. And it's incredible because his last words were like, dude, that's so cool, because he had not stopped hiccuping for 3 solid days. And just with one little click of the switch, his hiccups immediately stopped. And that was really, really impressive. And that just shows when you identify with the underlying neural root pathology, like we do in neuropuncture, and then we treat that underlying neural root pathology. If we hit that right, changes immediately occur, because that's how the nervous system can respond.
Wow, that's a really amazing and cool case.
Yes.
Definitely. Yeah, so I hope we'll see you soon in Israel in the workshop.
Very much looking forward to it, Eli. I got a lot of great things to share. We have some advanced vagal nerve modulation and stimulation techniques in the ear that we're going to be discussing. So a lot of advanced neuromodulating techniques, but it's not just for the advanced practitioner. Even if you're new to neuropuncture or new to neuroscience, acupuncture, or even new to acupuncture, and you want to learn some scientific-based neuroscience, electroacupuncture, you're going to love this.
Yeah, maybe I can share from my experience. I'm a partially new acupuncture. I started my studies in 2018, and I finished them 4 years later in 2022. And so I'm pretty new in this acupuncture world, and I've been studying neuropuncture for only 1 year, even less than a year. And results I see in my clinic are definitely amazing. They're fast, they're precise, and I really have managed to get a better understanding and better language with my patients, with their doctors and other physicians and doctors and clinics. So is possible for people who don't know about neuroscience to learn about it and
Absolutely.
dive into this world.
Absolutely. And I tell everyone, I am a classically trained acupuncturist. So this system was created by a classically trained acupuncturist for the classically trained acupuncturist. So I'll hold your hand and take you through it and make sure you really understand it clearly. Promise you.
Awesome.
Thank you, Eli. Appreciate it.
Thank you, Dr. Mike.
I'll see you guys later on. See you soon. Take care. Ciao, ciao.